birth of every child is a miracle. But for some, making that dream a reality means facing insurmountable odds. Carrie McCartney was 6 months pregnant when her unborn baby was suddenly fighting for its life.
I'd asked her, I said, what is that? And she said, it's a very large mass.
It was absolutely gigantic. It was the size of a grapefruit.
I knew that if we didn't do something, this baby would not survive the pregnancy.
It's the unbelievable story of a baby who had to be born twice to have a chance at life. Stephanie went into menopause when she was only 14 and was told she could never conceive a child.
I was crushed. I was just so heartbroken.
But Stephanie's twin sister would give her the ultimate gift. Along the way, they would make medical history.
These girls came up with the idea on their own. None of the doctors thought of it.
Two families desperately trying to bring a baby into the world. Two families that needed a miracle. Pastor Chad McCartney and his wife Carrie of Laredo, Texas, always knew they wanted a house full of kids. After the birth of their fourth child, Maya, they wondered if their family was complete.
We started asking ourselves, are we really, ready to be done? And we realized we weren't.
We could still, in our minds and our hearts, still see one more face around the table. And so we thought, one more.
So when the couple announced in October 2007 that Carrie was pregnant, the entire family was thrilled, especially the older kids, 12-year-old Taylor, 9-year-old Christian, and 8-year-old Tanner. Carrie, who had just turned 40, intended to cherish every moment of this last pregnancy.
I felt great being pregnant, had great deliveries, recovered well afterwards. All of my pregnancies, all 4 of them, were very normal.
Going to find out about our baby.
On Friday, February 15th, Carrie was nearly 6 months pregnant and feeling great. She was due for her 23-week ultrasound, so the couple piled their kids in the car and headed for her doctor's office, 2.5 hours away in San Antonio.
What do you think about Abigail? The discussion on the way up was it going to be a boy or was it going to be a girl, and whose room was he or she going to be in, and what were the names going to be, so everyone was really excited.
With the entire family in the room, Carrie asked the question on all of their minds.
Towards the end of the ultrasound, we said, what is it a boy or a girl? And she goes, oh, it's a girl.
But there was something else on the scan that caught the eye of the technician. A large, mysterious shape growing from the baby's tailbone.
I could tell it wasn't supposed to be there. And I'd asked her, I said, what is that? And she said, well, it's a mass. And I said, is it a large mass? And she said, yes, it's a very large mass.
At that point, she asked our kids to leave the ultrasound room and said, I'm going to have you talk to the doctor about it.
Carrie's doctor informed them that the mass, which was almost as large as the baby, was an extremely rare type of tumor called a sacrococcygeal teratoma. Although not malignant, the blood-filled tumor posed a serious threat to the baby's life.
This tumor, because it was so vascular, would probably, most likely, continue to grow, and that our baby would probably die of heart failure because her little heart would have to fill the tumor with blood as well as her own body, and it would give out. And she said, most likely she has less than a 10% chance of living.
I'm so sorry.
It was a very long, quiet ride home. They were asking, would we have a memorial service for her? And when people tell you there's a 10% chance that she could live, the flip side is there's a 90% chance that she would die. And I just wasn't ready to accept that yet.
By the time the McCartneys got back to Laredo, sorrow had given way to determination.
I thought, I'm going to get home and I'm going to look on the internet and find out what I know.
The couple spent most of the weekend on the computer researching these rare tumors, which occur in only 1 out of every 40,000 pregnancies. The cause is unknown.
And that's when we first found that there was a possible surgery that could be done. Up until that point, it was just, you wait it out and see if she makes it.
But only 4 children's hospitals in the country perform the highly specialized surgery. The next morning, Carrie contacted the nearest one, the Texas Children's Hospital in Houston.
First thing she said out of her mouth was, my baby's been diagnosed with a tumor, and and I just happened to think sacrococcygeal teratoma, and she said yes. And as soon as she said that, she actually started crying on the phone because she knew that if I could pronounce the tumor, the sacrococcygeal teratoma, that obviously I'd heard about it before.
She said, well, where are you going to deliver? And I said, I don't know. I said, I don't know where I'll deliver or who will deliver me. And she just said, Carrie, she goes, you're going to deliver in Houston.
I knew when she was telling me how serious the ultrasound was that she needed to get here as soon as possible, and she needed to be treated as soon as possible.
Love you, pal.
In 24 hours, Carrie and Chad were on their way to Houston, desperate to save the life of their unborn baby girl. They had already chosen a name for her, Macy Hope McCartney. We
just felt it was really important that we had a name for her, no matter what happened. And so we knew we wanted to use Hope as a middle name in particular, because that was all we really felt we had.
When they arrived at the hospital, the medical team was ready for them. They performed an ultrasound and an echocardiogram on baby Macy's heart. They were stunned by what they saw.
The tumor was incredibly large. It was one of the largest we'd ever seen. The tumor probably weighed between 500 and 600 grams, and Macy only weighed about 650 grams or so, so the tumor was virtually the same size as Macy.
That tumor had a lot of vascular flow to it, so the vascular flow made the baby's heart pump more than twice the amount it should be pumping out to the tumor, so it was doubling the workload of the fetal heart.
Fluid was starting to accumulate around the lungs and around the abdomen and around the heart, and these are signs of fetal heart failure.
And I, in my heart of hearts, knew that if we didn't do something, this baby would not survive the pregnancy.
They parallel each other. You need 4 to 5 weeks for the heart to remodel.
The entire fetal center team met to assess the case. Neonatologists, fetal surgeons, cardiologists, and obstetricians. Their conclusion was unanimous. Unless something was done soon, the baby would die in utero of heart failure. Her only chance of survival was an extremely risky surgery before birth. The highly complex procedure would involve making a large incision in Carrie's abdomen, taking her uterus out of her body, opening it, and taking the baby almost entirely out of the womb so the tumor could be removed. The baby would then be put back into the womb and hopefully able to stay there until full term. The team weighed the possible risks for both mother and baby during the surgery, including extensive loss of blood, heart failure, and triggering preterm labor, as well as the risks that would follow the operation.
Most likely, I would have to stay in Houston and be on bed rest because after having that surgery, my womb would be very nervous and shaky, and most likely I would go into early labor.
And there were no guarantees of success. The best they could offer was a 50% chance of survival. In fact, the surgery baby Macy needed to save her life had been performed less than a dozen times worldwide, and never at the Texas Children's Hospital.
The couple had their back against the wall. Is it experimental? No, it's been done before, but has it been done with the point that there's enough information to tell us what true odds are? No.
We had almost at that point decided not to do the surgery. It just seemed the odds were against her. Our daughter is just going to be an experiment, and we're going to go through this huge risk.
But the risk of doing nothing and losing their baby was increasing by the minute.
We didn't feel like we had a lot of time. They let her go too long and she gets too sick, then it's too late to do the surgery. So there was a good chance we could lose her.
This was a Tuesday. They felt they had to do the surgery by Thursday because her heart was decreasing so quickly. So we needed to give them an answer the next morning as to what we were going to do.
After an agonizing night, the McCartneys called the hospital with their decision.
We said, yes, we're going to go forth with the surgery. Bye-bye. I knew that there were no guarantees, but I felt as a mom, I had to do all that I could do. And I knew that if she didn't make it, that I would have absolutely no regrets.
Bye-bye.
The time factor involved for this particular baby was actually racing the clock. From the first day that she came in for her evaluation, her heart actually had started to deteriorate right before our very eyes.
Things were getting worse on a minute-by-minute basis, and so we were all anxious.
Without surgery, the baby they had named Macy Hope would die in utero. But removing the massive tumor from the baby could be as deadly as leaving it on.
When we cut off the blood flow to the tumor, there's going to be a big change to that heart. Suddenly now, the blood flow is only going to go to Macy's body, and that's going to be very risky. The other thing is this tumor has a huge amount of blood flow to it, and there's a risk that there's going to be bleeding during the operation. And if the baby loses significant amount of blood, then that can be a problem that we can't correct as well.
The surgery also comes with enormous risks to Carrie. Opening the uterus could cause extensive bleeding or trigger her body to go into preterm labor. 48 hours after arriving at the hospital, Carrie was being prepped for surgery with no way of knowing whether her baby would still be alive when she woke up.
And I just gave her a kiss right before she left, and then I headed down to the chapel. That was the only thing I felt I could do, was just pray, because everything else is really out of my hands.
Inside the OR, a team of 19 doctors, nurses, and technicians went to work preparing for the massively complex procedure to try to save baby Macy's life.
Fetal surgery is absolutely a team operation. It's one of the very few things that we do that involves such a huge, comprehensive team. This is one of the few things in medicine where we're operating really on 2 patients at the same time. We have to go through the mom first in order to get access to another patient, this unborn baby. And this is very, very unique. There really is nothing else that we do in surgery or in medicine where we're operating on 2 patients at the same time. In order to do that, you have to have a very well-orchestrated team that are taking care of the mom, that are focused on trying to treat the problem in the fetus. The atmosphere in the operating room was tense. This was a very risky situation. Macy was dying. Right at the time of the operation, we did a study on her heart, and it was the worst that we had seen. If the fetus heart is failing, then there's a chance that she may not survive the operation.
Before surgery can begin, unusually high doses of anesthetics are given to Carrie to ensure that at only 6 months into the pregnancy, her uterus has no contractions during the operation. Once anesthesia has taken effect, the first step is to make a wide incision across Carrie's stomach.
It had to be large enough to be able to tip her entire uterus out of her abdomen.
But before doctors can open the uterus and get to Macy, they have one more obstacle to overcome. The massive tumor growing out of Macy's tailbone is weighing her down, keeping her in a breech position. With not a moment to waste, she has to be manually flipped into the right position, or the surgery will be impossible.
Her head was up where we were going to be, but the tumor was far, far away. So really it's necessary at this point to turn Macy around. And that's a very tricky and challenging thing, because there's the uterus, there's the placenta, there's a huge tumor inside, and there isn't a lot of other space.
I actually had to put my hands on the womb and turn Macy to head first, so that the tumor would be at the top of the womb where we could gain access to it.
But we also have this pressure of time. We're trying to do things quickly because we can't take a real long time during this operation, or Macy's heart is not going to survive. It's not going to last during the operation.
With the baby in the correct position, the riskiest part of the surgery begins as Carrie's entire uterus is removed from her body. Working quickly, Dr. Cass must be absolutely precise in determining where to open the uterus or risk losing baby Macy on the spot.
The first danger was the fact that the placenta was on the front side of the uterus. The placenta is where Macy is getting all of her oxygen and all of her blood flow. And so it's very important that we open the uterus in a place where the placenta is not located, toward the back. We then made an opening in the uterine wall, and at this point we saw the tumor for the first time, this gigantic tumor.
2 hours into the surgery, baby Macy is lifted out of her mother's womb. The massive tumor growing out of her tailbone is the first thing to emerge.
It was absolutely gigantic. It was the size of a grapefruit, and it was really bigger than Macy was. And in order to try to remove it, it's necessary for us to separate the tumor from her anus and from the rectum. And in this small fetus, that's a very delicate endeavor.
A monitor is placed on the baby's tiny foot to keep track of her heart rate. To remove the tumor quickly, the surgeons are forced to cut straight across it. But because it's filled with blood, they have to find a way to do that without Macy bleeding to death. The solution turns out to be a specialized instrument called a harmonic scalpel that uses ultrasonic waves.
It would allow us to cut across the tumor tissue and to coagulate the tissue at the same time to try to minimize any chance of bleeding. So we used this instrument during the operation, which is probably one of the first times that instrument has been used during a fetal operation, and it worked incredibly well.
Time is now critical. The goal is to only expose the baby to the outside elements for less than an hour. Every minute puts additional strain on her already weakened heart. As the surgeons remove the tumor, it is vitally important to keep the top part of the baby inside Carrie's womb.
If you were to remove the baby completely, then the uterus thinks, aha, there's no pregnancy anymore, and it wants to close off. It wants to go into labor. So we try to keep as much of the baby inside the uterine cavity as possible to allow the uterus to think there's still a pregnancy.
Throughout the surgery, Dr. Moise and fetal cardiologist Nancy Ayers keep an eye on every beat of Macy's heart.
The major concern we have is the heart actually stopping and not being able to get the heart back again. We saw during the procedure numerous times where the fetal heart rate declined to a very critical level, and we would respond with medications, and we would stop pressure on the baby, pulling out the baby. We would make sure that the baby was positioned well, that there was no compromise to the umbilical cord, which is a very critical part of the surgery to make sure that the baby is still getting adequate perfusion to the baby via mother and via the placenta and the cord.
The team takes less than 20 minutes to remove the tumor that had been draining away Macy's life. But now her tiny heart faces its biggest test.
When the mass was actually removed, the heart became stunned, and you could see a decline in the heart rate, and that was very worrisome.
Now the team must get Macy back into her mother's womb as quickly as possible.
We tucked Macy back into the uterine cavity, and we began to stitch closed the opening that we had created in the uterus. And we were able to get it pretty sealed. We then put a piece of the omentum of Mrs. McCartney to help seal the uterine closure. This omentum is this fibrofatty tissue that has lots of cells in it that can help seal things inside the abdominal cavity, and we were hopeful that it would help seal the uterine closure and help prevent the amniotic fluid from leaking out. And we were all very anxious at whether or not the uterus was actually going to continue to stay pregnant and whether it was going to stay sealed, because that part of the uterus is the part that's continuing to expand as Macy continues to develop, and there will be a chance that it could break open.
Once the uterus is sealed, Carrie's massive incision is closed. 4 hours after it had begun, the surgery was finally over.
And at the end of the operation, we were absolutely ecstatic that things had gone as well as they possibly could.
Baby Macy tolerated the procedure well, Mom tolerated the procedure well, and it really went totally as planned.
Apparently, the first question I asked was, did Macy make it? And he said, she made it. She made it. And then the next question I'd asked was, but did they get the whole tumor? Did they get it all? He said they got it all.
Now the process of waiting begins. We have to hope that the uterus is not going to go into labor, because if she were to be born in the next few days after the operation, it was very likely that she would die because she was still just too sick to survive outside the womb.
Macy had beaten the odds and survived the extensive surgery. But just 24 hours later, this tiny baby was once more fighting for her life.
She was getting sicker and sicker. They were seeing more and more fluid around her heart, around her skull, which are all signs of heart failure.
There was fluid around the baby's abdomen, and so clearly something had happened that even though the baby left the operating room looking really very good at that point, the next day the baby looked very bad.
Carrie, too, had taken a turn for the worse since the surgery.
We've made a big cut in her womb. We've sewn it up. The womb's not happy about that. It begins to contract. So we have to put some major medications on board to stop that from happening, and they have side effects. In particular, they can cause mom to retain fluid on her lungs and need oxygen, and that's in fact what happened to Carrie.
Carrie was very sick just from the medication, so that was difficult to see her in that state, and at the same time, seeing our baby continuing to go downhill, things just weren't looking real good at that point.
Carrie's doctors must make a lightning-quick decision to try to save Macy's life again. During and after surgery, doctors had to put Carrie on extremely high doses of medications that prevent labor. Now, just 24 hours later, those medications were threatening the baby's life.
Macy was being exposed to medications we were given to mom to stop contractions that were affecting her heart also. So we had a heart that was already working very hard, and we're making it work harder with some of these medications. And she was having a tough time the first day.
While the baby struggled inside the womb, her tiny body filling with fluid, Carrie was also suffering.
We were in a very difficult situation where mother was very symptomatic. She had a lot of fluid on her lungs. Her x-ray didn't look good. She was requiring oxygen therapy, and she was really quite sick.
The team decided to take Carrie off one of the medications that was keeping her uterus quiet, knowing the risk that her body could go into labor. For 24 hours, everyone waited anxiously to see if this would relieve the growing pressure on the baby's heart.
When they checked her, the fluid level had gone down, her heart was getting stronger, and everything was turning and heading in the right directions.
Both mother and baby slowly regained their strength, but there was still one more huge hurdle. To have a chance of surviving after delivery, Macy had to stay inside her mother at least 2 more weeks, until she was 27 weeks old.
At 27 weeks, she's a fairly viable baby. You know, she still would have to deal with premature issues, but to deal with the premature issues, we wanted her as strong as possible.
A week went by, then another, and still Macy remained inside her mother. But even as Macy grew stronger with each passing day, Carrie's heart ached for her 4 other children back home in Laredo.
The kids had made frequent trips over, you know, once every 2 or 3 weeks with my parents. And it was so good to see them, but it was also so hard to see them go.
We'd talk to the kids in the morning, we'd talk to them again at night. You know, whatever we could do to create some kind of a routine in our day was really crucial.
I love being a mom. I love my job as an at-home mom, and I missed them. I missed being their mom. So 27 weeks was their goal. They said 29 weeks would be great. 30 weeks, if we hit the 30-week mark, that would be amazing. And they said, and if you ever got to 32, it would be a miracle.
Defying all odds, baby Macy stayed inside the womb for 10 weeks following surgery, until she was 34 weeks old. Macy was now close to being full term, but this medical miracle posed a new threat to both mother and baby.
I was concerned that something could go wrong. The wound continues to get bigger, that incision could break open in the back, we could lose baby Macy into mom's tummy, and then we would have lost all of our efforts. And so we decided enough was enough, and it was time to have Macy come into the world.
On May 7th, 2008, Carrie was once again wheeled into the OR for the birth of Macy Hope.
It was full circle. I mean, I had been holding her hand when she had her epidural placed, when we went into the big operating room for Macy's surgery. And then I went back into the operating room to hold her hand while she had her epidural be placed for her C-section.
Here she comes.
We had to do it by C-section because she had this incision on the back of the womb, so we didn't want to stress that in labor.
Chad went into the C-section with me, and he was there for every delivery, but I had never had a C-section, so this was a whole new experience.
And there she is. 824. She's got her eyes open. You guys see that? She's kind of peeking.
After all she'd been through, the doctors weren't taking any chances and immediately started monitoring Macy's heart and other vital signs.
So we'll take her in to see Mommy for a second. Before you put her in.
No one in a million years would have ever thought that Macy would have been so big and so healthy when she was born, when her odds were that she wasn't even going to be there.
6 pounds, 1 ounce care.
She's bigger than we thought.
She's the most beautiful little girl I'd seen. I mean, she had gone through hell and high water and had made it in the world.
And it was so much joy on her birth date, but there was just so much celebration going on because she had made it. I have been praying that I would hear her cry, because to hear her cry would just mean life. So as they were saying, they're pulling her out, and then it was silent. And I couldn't understand why she wasn't crying. I found out later that they believed she may have swallowed some meconium, and so they didn't want to stimulate her to cry until they got her out into the hallway with the NICU staff that could assess her and take care of her out there.
She didn't even get to see her other than for maybe 5 seconds. They brought her in until that evening up in the NICU. So it was a joyful day to see her being born, but it was also a challenging day.
It wasn't quite the delivery that I had anticipated, but in the big picture, she was delivered and she was alive, and that I celebrated more than the loss of not hearing her cry. I thought, I'll have many more nights now to hear her cry.
After a full medical assessment, it was obvious to the entire family that Macy was thriving.
They realized she didn't need oxygen. They were starting to take things off of her because she was managing on her own. And I think at that point is when I really started to get excited.
It was just as if, I'm here and everything's gonna be okay.
One month after her birth and 6 days before her original due date, Macy Hope finally came home to Laredo.
For all intents and purposes, we shouldn't even have her. The odds were so far against her that, we're holding this little miracle.
I'm so thankful to God that He said yes. I don't understand it because not everyone gets yes. And for some reason, He chose to give us yes.
Carrie and Chad, our couple, are one of the most amazing couples that I've ever actually been exposed to in my almost 30 years of nursing. Their just strength that they actually had together as a couple and as a family, and their drive and determination to basically get Macy the help that she needed.
We've done some other fetal surgery operations, but this is the most remarkable case that I've ever been involved in. I think that there must have been forces outside of our hands that helped work in this situation.
And I told Mom in clinic the other day, I own one little toe, but I feel like I own a part of your daughter, and she'll always be a part of my heart.
Okay, is it my turn? Yep.
The other day I was holding her and her little eyes were just studying my face, and pretty soon she just smiled and started to coo, and it just brought tears to my eyes because I could hear in my head, she has less than a 10% chance, and I thought, she's here, she is here.
In the small town of Muscle Shoals, Alabama, everybody knew Stephanie and Melanie Fuller, identical twins who were rarely seen apart.
Fuller twins. There's the Fuller twins.
Yeah. We didn't have names, but we were the Fuller twins, so that was fun.
That's all they knew was Fuller twins.
Scoot on up on the hill, Stephanie. She looks a lot taller than you.
Even though they looked alike, Stephanie and Melanie, the older sister by 5 minutes, always had distinct personalities.
Melanie was what I like to call the tomboyish, outgoing one, and Stephanie was always what we called the little princess. She was always the one. She kind of followed behind Melanie.
Stephanie, hold on. You got to help balance.
The popular, life-loving twins did everything together.
This is my baby.
Me and Stephanie did share everything. We shared dolls, we shared rooms, we shared hairspray, we shared everything,
We played softball together. We had the same friends.
Not to mention, splitting up the chores, and you have to do everything by yourself.
So we were always going out together. We just did everything together.
So it was no surprise when the twins entered puberty at the same time. Both girls got their periods at age 11, but 2 years later, that all changed. While Melanie continued menstruating every month, by the time she was 13, Stephanie had stopped completely.
I didn't know that it was not normal until I told my mom that it had been so long and I didn't have a period. Mom was like, well, that's not normal. We went to a local doctor here, and they sent me to Birmingham, and it was more blood testing, it seemed like, than anything else.
Doctors told Stephanie's mother that the change in Stephanie's menstrual cycle could mean she had a severe autoimmune disease or some type of cancer.
The doctors said that, her organs could start shutting down, and, this could kill her, and it was just terrible for a few months around the house.
After 6 months of extensive testing, it was determined that Stephanie had premature ovarian failure, or POF, a condition that occurs in 1% of women. The cause is unknown. In Stephanie's case, she was born with so few eggs that just a few months of menstrual cycles had wiped them all out. Her ovaries had stopped functioning completely, putting her in menopause at the age of 14.
I was having hot flashes, I was having night sweats. Well, I didn't think anything about that, because we never talked about menopause, because who at 14 is going to talk to their children about menopause, The doctor was telling me that I needed to take calcium for my bones because they, the osteoporosis, that they would deteriorate. And of course, when he said deteriorate, that's all I needed to know. I didn't understand that, but I knew that wasn't a good word for him to be telling a 14-year-old.
For reasons doctors don't understand, POF is more common among twins, although it usually affects only one. For the Fuller twins, it was the first experience in their lives they couldn't share.
Going through menopause as a teenager, it made me a little different. I was on hormone replacement therapy from the time I was 14, and if I didn't take it normally, I would have the hot flashes. If I took it normally, I wouldn't, as much. I didn't understand all this that was going on. I knew that none of my friends were having to do this. I knew it was me.
It really broke my heart to watch her have to go through menopause at that age, because I knew what it meant. She didn't, but I knew what it meant.
Stephanie, you're just sparkling.
What it meant was that Stephanie would never be able to conceive a child. The full impact of this wouldn't hit home for another few years. In 1998, when the twins were 18, they each married their high school sweetheart. Melanie gave birth to a baby girl later that year, so it was only natural that Stephanie and her husband, Kevin, would want to start a family as well.
I always wanted kids growing up, and she did too, and that was always a desire that we had.
Even when, when the doctor told me that I may not be able to have children, and it didn't completely sink in, I thought, okay, and I got older and I started realizing what that meant, but before that, I always wanted to be a mother.
In fact, the twins had been talking for years about how to make Stephanie's dream of motherhood come true.
The doctor, when he had diagnosed me, he pretty much told me the only chance of me having children would be the donor egg program. And so that's when Melanie said, okay, that's what we're gonna do. She can have my eggs.
But even though her sister was ready and willing to donate her eggs, the high cost of in vitro fertilization was too much for Stephanie and Kevin. So they started saving every penny they could. Meanwhile, Melanie and her husband welcomed 2 more daughters into the world.
It got harder with each child that she had. Not that I wasn't excited about my nieces, but I wanted that.
After years of saving, Stephanie and Kevin were ready to try in vitro fertilization. As promised, Melanie donated her eggs, which were collected and fertilized using Kevin's sperm. In May 2003, 2 embryos were implanted in Stephanie.
We expected it to work. We had no doubt that it would work.
I thought, we're identical twins. Of course it's going to work,
2 weeks later, they got the results. Stephanie was not pregnant.
It was the most heartbreaking thing I'd ever been through. Not, because it wasn't me that it failed for, but for her.
I was crushed. I remember just sobbing about it, just crying my eyes out. And I was just so heartbroken.
That was a really bad day. That was one of the hardest days. Wasn't something that Mother could fix. And that was the hardest part of the whole thing, was this was not something I could fix or buy or do or love enough to make it better.
But Stephanie refused to give up, undergoing a second round of in vitro. That also failed.
There was times where I got down and just thought, I may not ever be a daddy. And that was hard for me because I wanted it so bad. She did too, but I guess I was more realistic, and I got to thinking, well, it may not be, it may not be.
I gave myself a season of pity where I thought that, what if I don't become a mother? But after I allowed myself that time, I got up and I thought, I'm going to be a mother.
So the couple decided on a new approach to parenthood.
We got approved for adoption, and we're really serious about adoption. And, something in my heart just wasn't right. Because I wanted to experience life. I wanted to experience a baby moving. I wanted to experience labor and delivery and just that afterglow of a new mother. I wanted the whole package. I wanted to be able to experience all of that.
Get off of me. No.
When Stephanie Yarber went through menopause at the age of 14, doctors said she would never be able to conceive a child. After 2 in vitro fertilization attempts failed, using eggs donated by her twin sister Melanie, it seemed like Stephanie's dream of becoming a mother would never be realized. But the twins refused to give up hope.
I always knew, that we would figure out something. Stephanie is really persistent, so I knew that she would find something, figure her way around, any little obstacle. She's just that way.
I got on the internet, started searching some things out. Of course, on the internet, stuff just kind of comes up when you put in a couple of little words.
Stephanie spent hours online reading through medical journals and research reports when something grabbed her attention. An article about a doctor who had performed a testicle transplant surgery between twin brothers in 1977.
I was like, wow. That's where I first started getting that glimmer of hope.
Stephanie wondered if a similar surgery could be performed between female twins, where an ovary would be transplanted. Another search led her to the doctor who had performed the surgery on the male twins, Dr. Sherman Silber, a reproductive surgeon and fertility expert at St. Luke's Hospital in St. Louis.
So I called, and he said that he had been waiting for this phone call for 25 years. Identical twin girls with a situation like this, for a surgery like this.
As soon as she hung up with Dr. Silber, Stephanie immediately called her sister.
I didn't have a doubt in my mind Melanie would donate an ovary. I almost didn't even ask her when I called her. I just called her and was telling her about it, not even thinking to ask her, because that's just how she is.
Losing an ovary never scared me because I still have one, and I have 3 little girls. I don't plan to have any more.
I would have thought that right there.
Dr. Silber and his team had developed cutting-edge techniques for removing and preserving ovarian tissue, but he had never performed an ovarian transplant between 2 women.
I told him I haven't done it in humans. I don't know if it's going to work, so you're taking a big chance, I told him. And in that cute, they're just so charming way, they just said, we'll take a chance on you.
The transplant would involve separate surgeries for each twin. First, one of Melanie's healthy ovaries would be taken out, and the outer layer, where the eggs are contained, removed and divided into 3 sections. One would be frozen for later use. The other 2 sections would be grafted onto Stephanie's non-functioning ovaries, renewing her ability to ovulate and hopefully conceive a child.
He's like, you know, I don't have statistics to give you. You're the first to do this. I don't have anything to give you. I don't have a percentage to give you. He said, but I really think it's gonna, you know, I really think we have a good chance of this working.
On April 23, 2004, the twins were on their way to St. Louis to undergo the world's first ovarian transplant. The morning of the surgery, the twins couldn't have been in more opposite states of mind.
Stephanie's sitting over there, bless her heart, with her Kleenex, and I was just flipping through, you know, to see what to watch on TV, because I thought, I've had a C-section, cannot be much worse than that.
Melanie was not scared of anything. She never really has been. If she is, she wouldn't have showed it to me.
Melanie went into the OR first. Dr. Silber made a small incision. Using a microsurgical technique, he removed her left ovary. As Melanie went to the recovery room, the medical team detached the ovary's outer cortex, where all the eggs are contained. This thin layer of tissue was divided into 3 sections. One would be frozen for future use. The other 2 were ready for transplantation. Now it was Stephanie's turn to undergo the more complicated of the 2 laparoscopic surgeries. First, Dr. Silber removed the outer layer of Stephanie's non-functioning ovaries. Then, a portion of Melanie's egg-rich tissue was grafted onto each one.
They were genetically identical, so we didn't have to worry about rejection. We basically took off the substance of all of Stephanie's dead ovary and put the new ovary for Melanie on there. What happens is the blood vessels grow into this thin tissue, and basically it comes out and forms a new ovary.
After 2 hours, both surgeries were complete.
I felt very relieved because it was tricky and difficult. So I was very relieved. It looked like it went very, very well.
The family drove back to Alabama the next day. It could be a long wait before Stephanie would know if the new ovaries were functioning. If they were, she would get her period again every month.
Dr. Silber told us to be expecting a cycle to come back around 6-9 months, something like that, and then, you know, we can start trying for a family.
But in July, 3 months after her groundbreaking surgery, Stephanie started menstruating for the first time in 10 years. And just 3 months after that, there were more changes.
I started taking my temperature, and my temperature stayed up, and it wasn't going down. And I thought, wow, that usually means you're pregnant if it don't end up going down. I was kind of scared to do a pregnancy test because I had taken many tests, and of course they were negative. So I was a little scared taking one, but I kind of thought I was. I took the pregnancy test, and when it came up positive, it was like an immediate life change. The first person I told was my mom and my sister.
I was just couldn't believe it. It was finally here. It was finally happening.
So everybody in the whole house started screaming, and of course my kids are saying, what are y'all screaming about? But everybody was really happy. We was so glad.
When her husband Kevin got home from work that afternoon, Stephanie handed him a gift bag with her positive pregnancy test inside.
He just sees that test in there. And so then he just starts hugging me, and I mean, we probably stood there for 5 minutes, and he was crying, and I was crying, and you know, because we were just so happy.
It was just like you flipped a switch. I mean, reality was finally here, you know, that I was gonna be a daddy, and it'd been a long road, I mean, and then we was finally there.
We'd waited for so long to be pregnant, and for him to experience being a daddy, and me experience being a mommy.
But after being in menopause for 10 years, would Stephanie's body be able to maintain the pregnancy? As the months went by, all signs were normal up to the 7th month, when Stephanie contracted a virus.
I'd started vomiting at work, and so I left work, went to the doctor's office. I started vomiting there, and so they sent me on to the hospital, got me hooked up on the machine. So that was a little scary, you know, because I was having some irregular contractions because of the vomiting. But once my contractions stopped, I was able to go home, and everything was fine until I actually did go in labor.
On June 6, 2005, 5 days before her due date, with her husband and her twin sister by her side, Stephanie had a completely normal delivery of a healthy 7-pound baby girl, Anna Grace.
The first time I got to hold Anna Grace, I just cried. You know, that was my child. And that was just an awe-stricken moment, you know, just to look at her and know that she was mine, know that God had given me such a perfect child. You know, she was healthy in every way.
When I held my baby girl for the first time, I felt like I was dreaming almost. It was undescribable. I don't know, it's just the miracle of life.
Stephanie and Kevin's dream had come true, and they savored every moment of parenthood. The only thing that could make life even more complete would be to have a sister or brother for their miracle baby.
After Anna Grace was born, we did try to get pregnant again, and we actually did get pregnant. We miscarried, and that was pretty hard. That was something that I never wanted to experience.
8 months passed without another pregnancy.
Dr. Silver told me when we originally done the procedure that he didn't know how long that the ovary would last. You know, there was just no way to know.
Well, it's beginning to expand again. I was concerned that maybe she was running out of eggs and maybe she wasn't making enough progesterone, indicating she was going to go into menopause again. So at that point, we suggested transplanting the frozen tissue.
In March 2007, Stephanie underwent her second ovarian transplant surgery, using another section of Melanie's ovary. No one knew for sure if this surgery would be as successful in helping Stephanie and Kevin conceive baby number 2, but they didn't have to wait long to find out.
You know, I got pregnant before I ever had a cycle with a cycle. It was still 5 months, but I was still waiting for a cycle when I found out I was pregnant.
Once again, Stephanie's body accepted the pregnancy. She carried full term with no complications. On April 21st, 2008, Stephanie and Kevin welcomed their second miracle baby, a little girl they named Addison.
You know, there was nothing else that she's wanted more than to be a mother. So it was perfect. It's what she's always wanted.
Mommy, don't need to be fixed.
Well, yeah, just a little.
Stephanie is an awesome person. She is a rock. She really is. She's been through so much, and just an awesome mom.
Very pretty.
You couldn't ask for a better mother.
Stephanie and Kevin think one more child will make their family complete. If her ovaries run out of eggs before their next child is conceived, Stephanie still has a nest of frozen eggs she can tap into.
She'll have as many kids as she wants to have.
Stephanie's simple desire to be a mother led her and Melanie to make medical history with the world's first successful ovarian transplant.
They were very brave women. I mean, they were pioneers, so to speak.
Never in a million years did it cross my mind that it would be something that would be like this, like groundbreaking. But then when when I think back on it, it's just like, that's something we did. And that's pretty awesome.
I can never thank her enough for what she has allowed me to become. You know, I'm a mother. My babies are miracles. Sometimes it still amazes me to look at them and to know what was done for them to be here today.